Hi, I'm Tressa Quell. I am the Associate Degree Program Director at Weber State University, and I'm here to talk to you about the difference between licenses and degrees for an associate or bachelor's prepared registered nurse. So first off, talking about licenses. So licensing, there's specific requirements and educational requirements in order to take a licensing exam. Usually for nurses, it is through the NCSBN. There are two different types of exams. The first is an LPN or LVN, so licensed practical nurse or licensed vocational nurse. It's used interchangeably. That licensing has a limited scope of practice in most states. And each state, here in Utah, they have limited practice and usually are working alongside with an RN, or they have a limited scope of practice if they are working independently. And then a registered nurse or an RN is a licensing also. It's a board exam through the NCSBN called the NCLEX. Once you have completed that and completed the state requirements, then you would be registered or licensed as a registered nurse. So the difference between the licensing and being a registered nurse and getting a degree, so as an LPN, there's usually not an associated degree with that. That's usually just the credential, the licensing requirements, and then it is that you can take the exam. With a registered nurse, it's usually an associate's degree or an associate's of applied science degree. And again, every university or degree granting institution will have different requirements for that. For students that are doing an associate's degree, a lot of research has shown that a lot of places are wanting bachelor's prepared nurses. At Weber State, we have a ladder program where we test at our associate degree and for the RN license, and then we have an RN to BSN. So students are able to work as an RN after their associate's degree and then complete their bachelor's degree.
So what about grad school? Hey everybody, I am Dr. Renica Holman. I am the chair of the Annie Taylor D School of Nursing here at Weber State University. And I just want to talk a little bit about grad school options and graduate degrees that we offer here at Weber State. We basically offer 4 degree options: associate, bachelor's, master's, and doctorate degree, the Doctor of Nursing Practice. Our master's degree options don't necessarily lead to any different types of licensures. So a person with a master's degree in nursing, explicitly here at Weber State, those 2 options basically lead to education. So somebody could become a nurse educator, work here at Weber State or any of our local partners. Or the other option is in management and leadership. And a management and leadership master's degree will help people working more in the clinical setting. As far as the doctorate degree goes, the doctorate degree, however, can lead to specific type of licensure. Throughout the United States, the main advanced type of licensure that a nurse can get is called an advanced practice registered nurse or an APRN license. And within that big umbrella, people can get different types of nurse practitioner licenses. They can be a certified registered nurse anesthetist. They could be a certified nurse midwife or a clinical nurse specialist. So those are the 4 types of licensure roles that a doctorate degree could do. So here at Weber State, we have a doctorate degree program that has 2 different tracks. One leads to a family nurse practitioner certification and then therefore licensure. And the other track is explicitly for people that already have master's degrees and then they want to get a doctorate degree, and that doctorate degree is explicitly in executive leadership. If you'd like more information, please visit our website at weber.edu/nursing. We have all kinds of information about all of our different programs there, or definitely visit our YouTube channel.